Hello, my name is Rafaela Steinauger, and I am the project coordinator for the Community Outreach Initiative of the Florida Birth Defect Surveillance Program. And today I would like to discuss a little about the project and how we can partner with you to improve awareness, prevention, acceptance, and access to care for children with special healthcare needs and their families. So as a general background, the Florida Birth Defect Surveillance Program, or BDSP, performs birth defect surveillance and research in the state of Florida. We work in collaboration with the Florida Department of Health and the Florida Birth Defects Registry, and our focus is in improving the accuracy, timeliness, and completeness of the Florida Birth Defects Registry. We also support and collaborate with stakeholders such as you on prevention and education programs and gathering information on the systems of care serving Florida families to improve access to health services and early intervention programs. So here's a list of the staff and collaborators of the project, including members from the Florida Birth Defects Registry and the USF Birth Defect Surveillance Program. So our funding from current and previous years come from the Florida Department of Health, the Centers for Disease Control and Prevention, the March of Dimes, and the Council of State and Territorial Epidemiologists. And our goal through this project are to increase surveillance capacity, to improve the quality of surveillance data, to expand data utilization and dissemination, to continue to grow prevention and education, and to increase the ability to respond to emerging threats to mothers and babies. So all BDSP activities will be accomplished by nurturing and engaging existing local, state, and national partnerships, as well as identifying and engaging with new stakeholders. With specific focus on awareness, prevention, access to services, and quality of life, our aims include to increase knowledge about birth defects prevention, the prevention of major birth defects and improved birth and health outcomes, intervention, referrals for services, increase early identification and linkage to health and other services for affected families, enhance collaboration to broaden program reach, increase utilization of health and other services for affected individuals and families, and improve dissemination of accurate and timely information to partner and stakeholders. And lastly, improve use of surveillance data to inform policy and resources allocation among stakeholders. So in this diagram, we go over a little bit all the activities that we have planned to achieve our aims and goals and how we are going to determine our success. So our activities include user surveillance data to identify at-risk populations within each community, develop and implement data-driven prevention strategies with communities using CDC and BDSP FBDR developed awareness materials, also to disseminate data that include rates, trends, risk factors, and services access and utilization, including differences by county, region, and social demographics. Also to improve the number and timeliness of referrals, and to access facilitator and barriers to track in children prospectively to improve understanding of health outcomes, educational needs, and quality of life for individuals living with birth defects. For our community outreach efforts, we aim to develop monthly awareness materials to be shared via electronic newsletter with our partners to provide surveillance and research updates and to identify priorities in the community. We will also share our special needs resource guide and our brochure, which is available in 4 languages, including English, Spanish, Haitian Creole, and Portuguese. And lastly, we will also have mini grants to support local efforts related to awareness, prevention, acceptance, inclusion, or access to care for children born with birth defects and their families. So thank you so much for hearing us today and for hearing our presentation. We're looking forward to work a little more with you and to get to know you a little better. Please feel free to contact me or Dr. Jennifer Marshall through any of the addresses below. Also, we have our website available here if you want to learn more of what we do and learn more about what we did in the past. Thank you so much.